about 2 years ago, we looked at what sort of mobile applications healthcare professionals would be interested in, and we looked specifically at clinical observations, vital signs, and came up with an application that we think was actually quite interesting. And in March of this year, I took the application into Chelsea and Westminster Hospital in London and showed them what we had been working on, and they became quite interested in it. And it's a recording application for, as I said, for vital signs, clinical obs, and it automatically calculates the news score, and a lot of the basis behind it is to take away paper. So there is a kind of inaccuracy where people are recording things manually. So we developed this application, we've fully integrated it into the PAS system. It's also integrated into the pathology, and so we're getting lab results. And we try to make it as visually rich and intuitive as possible. Chelsea Westminster are using it in their AAU, their acute assessment unit, and the emergency department. Their plan in 2015 is to roll this out across the whole hospital. From their side, in talking to us, they said it's got to be user-friendly and highly intuitive, flexible, adaptable, provide the data in real time, be very secure, absolutely no data to be stored on any device. So we made it a web app. That was the simplest way of doing it. No data on any device, and therefore it's device agnostic. We don't care what people use. And so we tried it on Google Nexus tablets. Google decided to stop manufacturing the Nexus 7, and are moving on to something else. We tried it on Samsung tablets, Windows laptops, Windows tablets. Because it's using HTML5 and a much richer and higher grade, if you like, development spec, it won't work on XP. And it's on Windows, it needs to be 10 and above. But I don't think that's unfair. I think if you want to develop applications that are touch-driven, then really you need to kind of set a bar. So as a side product, if you like, we have come up with a sort of bed management application. I'll do a demo in a few minutes. Hopefully it's all going to work well. But if you think about the way doctors or clinicians approach patients on a ward, they typically walk onto a ward and they start in bed 1, bay 1. And they make their rounds and they go one by one around the hospital, around the ward, checking on the patients. But we thought, is that really the right approach? Wouldn't it be better if you knew who was the sickest patient on the ward and you went to see them first? So if you can visually represent the patients in a view of some sort, seeing where the beds are in the ward, then you can go straight to that bed in the ward without actually anyone having to tell you, well, C1 in Bay E is in this location. You've got to walk down the corridor and turn left after the third entrance. So all of these represent patients in beds, and the hospital can create their own view. So built into the application is this ward layout editor tool. They can create their own view. Once they've named all of those bays and beds and saved it into the database, it auto-populates with the patient information. So it's got the demographics, it's got their names, it's got details. And once they then touch on that bed, they can drill down into more of a summary view of what the patient observations are, what the last obs were, and then they can even go into a chart view, which the standard chart that they're using today, which they record on once they've written everything down on a piece of paper and go back to the workstation, and they're using this observations chart on the left. But by doing it all automatically, they're not having to draw lines, they're not having to get the numbers in the right boxes, they're not having to add up the news score and get it wrong. It's all being done automatically for them. keeping it as simple as possible to add those observations, we thought, instead of typing numbers, why not use slider bars? So the little gray bar on the left is the slider start bar. And once you've taken the obs, you just move the bar across. And once you've got the right value, move down the page, and then you can save. And in that saving process, it does three things. It calculates the new score. It gives you a protocol warning to tell you when what you need to do based on the new score, when the next set of observations need to be taken. It can send out alerts. It might even give you a glucose warning, hypo or hyperglycemic warning. And if there is a potential of sepsis, it will alert you to sepsis, and then take you to a sepsis check screen where you can move on and perform a severe sepsis check. And severe sepsis is a killer in this country. 37,000 people a year die of sepsis. It's a preventable disease based on how early it's caught. So the idea here is we capture it very early on, because if you think about observations, typically if you take observations individually and you don't understand necessarily that if you put them all together, it's looking at multiple observations together that can tell you just how sick a patient might be. So sepsis requires 2 of 5 potential indices that warn you that sepsis might be there. And this is the point of the application. It's doing that. It's pulling in white cell count, blood results, observations, adding everything together. If the patient has sepsis, then the clinician knows what the next steps need to be. Providing they've added in weight and height, which is a feature of the app as well, then what they will be able to do at the end is calculate the antibiotic dosage and then administer the drugs. What Chelsea and Westminster are doing is making, I think it's level 7 nursing, empowering them to administer antibiotics in cases like that, rather than requiring a registrar or a doctor to have to come onto the ward. In order to do that, they want to capture as quickly as possible and administer as quickly as possible to improve patient care. Because every hour lost with a patient who's got sepsis is a 7% increased risk of death. So just giving you an idea of how long it's taken, we engaged in March, we're now live. So we took a very agile approach to our development. Although we took an app that we'd already essentially developed, it's been a continuous evolving process of working with clinicians, doctors and nurses, getting their input, looking at their requirements, translating those into developing the application. What we're in the process of doing at the moment is really deciding or helping them to decide which is the best device. And although lots of people I know have gone down the Apple route, Samsung are a very keen vendor, I understand, looking at the healthcare market. Just thought I'd give them a little pitch there. Okay.